Thank you, Mr. Chairman, and good morning. Thank you to our witnesses for being here and for all our veterans who's joined us today, especially those from Arizona. Commander Oxford, it was a pleasure working with the American Legion to pass the Legion Act, and I'm so excited to be working with you again to establish a pilot site for Project Atlas in Arizona. This program is an innovative partnership between the VA, Philips Healthcare Systems, and the American Legion, and it's bringing remote telehealth exam rooms that connect veterans with the VA to regions where those connections are hard to establish. Arizona's rural veterans will be greatly served by this partnership, and thank you for your leadership with this effort. I share the American Legion's position that we must continue to improve access to care for military sexual assault survivors. Research has shown that peer support specialists are a significant factor for veterans seeking help with experiences such as military sexual trauma. Can you speak about the VA's peer support specialists and their impact on veterans seeking treatment for MST?
I'd like to ask Director Bryant to address that question.
Thank you.
Thank you, Senator. We recognize that peer-to-peer support is critical in navigating the VA, especially for survivors of military sexual trauma or assault. There's the potential of re-victimization, re-traumatization as you're retelling and recounting your stories repeatedly throughout that process. It's necessary for medical documentation, but we know that can also be extremely painful to the veteran, and not just to women, but to men as well, because men are also survivors of MST. So those peers that help you navigate the system are vital in going forth and having your service connection annotated in a way that is safe for both the veteran, and they're in an inclusive environment where they are safe to share their experiences and then also receive the desperate care that they need.
Thank you. And Ms. Bryan, a follow-up question. What are some other steps that we in Congress can take to make military sexual trauma care more available to survivors throughout the military?
To make it more available to those throughout the military is, one, in expanding what we're doing in our community partnerships. We want to ensure that the provisions that are under the House version of the Deborah Sampson Act, that those possibly can get reconciled with the Senate version that is going forward. And thank you again to Senator Bozeman for your support with the Deborah Sampson Act. But there's a lot that we can continue to do to have our arms wrapped around those women and male survivors of military sexual trauma. And we look forward to working with you and your staff on this further.
Thank you so much. Commander Oxford, a skilled VA workforce is crucial to the delivery of care and services to veterans. Since fiscal year 2011, the VA Office of the Inspector General has listed human resources management in the top 10 non-clinical occupational shortage areas across the Veterans Health Administration. How do you think that this shortage impacts VA's ability to provide timely and quality care to our veterans?
As we tour the country, and we've been to several veterans hospitals, VA hospitals, we have seen several staff shortages because of lack of the ability to find and hire qualified professionals. In addition to that, I'd like to ask Chairman Bozzella to address the issue.
Thank you, Commander. Thank you, Senator. The HR problem of not enough providers is one of the #1 issues that we see within VA, but it goes beyond providers, as you suggested. And the American Legion is trying to help VA with the onboarding process for one issue, and onboarding, again, for healthcare providers as well as non-providers. It could take 4 to 6 months for somebody who's applied for a job in the VA to be able to finally accept that position, get on board, and be working at that particular facility. There's another problem with transference of jobs and providers, and again, non-healthcare providers, and it's a difficult process. So that's the #1 thing we think that outside of recruitment that people have to work on is how quickly can we get somebody into that job.
And Chairman, if I might follow up, what should the VA and Congress do to address that specific issue and other personnel challenges we face?
I believe there is a bill, I don't know where it is, it hasn't reached committee yet on the Senate side, that is looking at that as a pilot study. And I believe it's Senator Gardner who has put that forward. What we understand is that bill may be looked at soon. But that's all I know about the bill at this point. But that is a start. So at least on a pilot, you'll be able to trial things and to see how they're working, and maybe if it becomes well enough practice, that could be replicated.
Thank you. Commander Oxford, as the VA implements the expansion of the Caregiver Support Program under the Mission Act, what should it do to ensure a more holistic and inclusive support program for our caregivers?
Thank you for that question. I think, first of all, we got to recognize the caregivers of all of the injured servicemen and women since the global war on terror. But we also need to recognize the caregivers from other periods, and there are several. But these caregivers have been essential to the readjustment of those injured veterans during their time of need. And as we think about caregivers, we've got to realize they are saving us money. If a caregiver is providing those services at home, then we don't have to pay somebody else to do it. So it is a savings to us, and we just need to continue the oversight of that issue. And let me turn this over to Director Newton for his comments.
Senator, thank you for your question. After a year to prepare, VA missed another mark in the Mission Act deadline in implementing the expansion of these benefits to these caregivers. It's a shame that these individuals don't have access to the financial benefit that by law they deserve and they've earned based on a technicality that VA themselves created with their IT issue. We'd like to work with both committees to draft legislation that will guarantee effective dates for these caregivers so that it can be compensated appropriately, just like disability compensation for these hardworking individuals.
Thank you. Thank you all for your time being here. And Mr. Chairman, I yield back.